you should at least have a little fun with it. So, I first want to thank Mrs. Frew for inviting me here to speak today, and also thank everyone in attendance for giving your attention to such a worthy cause. Today I am here to represent a vision of what every patient with a rare disease and every parent raising a child with a rare disease would like to see. Since the time I was diagnosed with cystic fibrosis at 3 months of age, I have qualified for Children's Special Health Care Services insurance. My father has worked for the same employer for my entire life, but they frequently changed their insurance. No matter what plan they had, my Children's Special Health Care Services insurance covered the entire cost of the numerous maintenance drugs that I was on, as well as any antibiotic treatments or hospital visits that were necessary. Though I did not fully realize it until I qualified for free lunch in high school, my family did not have much in the way of extra money. If my illness had forced us to face any significant medical costs, I shudder to think what would have occurred. When I became 21 years old, I was able to continue utilizing Children's Special Health Care Services insurance. CSHCS covers over 2,600 medical diagnoses, but only people with cystic fibrosis and certain blood disorders are allowed to continue using it into adulthood. When I was hired at Canton High School in 2004, my wife and I had fabulous insurance through the district and made enough money that the cost of retaining Children's Special Health Care Services insurance no longer made financial sense. However, when my health deteriorated significantly a little more than 2 years ago, it was simply a matter of filling out some paperwork for me to resume coverage with CSHCS. I waited a year for a double lung transplant, during which Children's Special Health Care Services covered all of my oxygen needs, medications, and hospital visits. The time on the waiting list was stressful. A concern over how much this life-saving procedure would cost me was not a factor. I finally got the call last summer, and the surgery and my over 2 weeks in the hospital recovering went as well as I could have hoped. Since the transplant in August, I have been on a litany of new medications, many of which have a several $1,000s per month price tag. Just as when I was in high school, Children's Special Health Care Services insurance saved my family from unthinkable levels of medical debt. About 1 month ago, an itemized bill for the cost of the transplant finally arrived in the mail. Between insurance for work and Children's Special Health Care Services, the over $500,000 procedure cost me $27 out of the pocket. With all the steroids the doctors have me on, I might be hungry enough to spend more than that at Claire's later today on work. Although there is no magic wand that will suddenly expand Children's Special Health Care Services insurance to cover all of its recipients beyond the 21st birthday, Senate Bill number 1083 represents progress toward ensuring that families do not suffer financially while they already deal with the complexities brought about by a rare disease. I am not more deserving of a life free from fear of medical debt, merely because I chose a career that offers excellence insurance, or because I have a disease that is somewhat more common than the ones which have affected the other families here to speak today. Being able to focus on living one's best and healthiest life with minimal attention paid to the issue of dollars and cents should be a reality for everyone.